Hello, I'm Dr. Monty Moore, pain specialist at Idaho Physical Medicine Rehabilitation. There's no doubt that living a life with chronic pain can be difficult and exhausting. There may be many ways of treating pain, including therapy, injections, exercise, and medications. Opioids, or opiates, are one of many drugs that we may prescribe. These are very powerful drugs that may reduce the intensity of the pain reaching the brain.
Some opioids, like morphine and codeine, are made directly from opium, while others, like oxycodone, hydrocodone, and fentanyl, better known under such brand names as OxyContin, Dilaudid, Norco, Vicodin, and Percocet, are man-made but are similar to opium. Not all patients with pain need to take opioids. Before taking opioids, it's important to incorporate the proper type of exercise, treatment of mood disorders such as depression and anxiety, and sometimes counseling or physical therapy. In some cases, a simple injection procedure may relieve or reduce pain. There's good evidence that smoking is a risk factor for chronic pain, so if you're still smoking, you should quit. Opioids are powerful drugs. In fact, they're so powerful, state regulations require IPMR patients to schedule regular clinic visits. There needs to be proof that the drugs are actually helping the patient live a more normal life. And IPMR doctors are required to ask our patients to submit to urine and drug testing and sign an agreement agreeing to opioid usage guidelines. That's because when opioids are used as prescribed by a medical professional, they can be a godsend. But when a patient misuses an opioid or disregards a doctor's warnings about their usage, severe consequences can and do happen. Let's talk about side effects for a minute. All medicines have side effects, but many people don't feel them or believe they can just deal with them. For example, opioids may impair brain functions like memory or concentration. Opioids may also suppress certain hormones important for endurance and strength, as well as adrenal and sex hormones. They may also suppress nighttime breathing. Dr. Mark Rasmus of Idaho Sleep Health explains.
So commonly there are four things that we can see associated with opioids and sleep. Those would be obstructive sleep apnea, where the airway closes at night, central sleep apnea, where the brain doesn't tell the body to breathe, hypoxemia, or low oxygen levels at night, and then abnormal sleep architecture, or abnormalities in the depth of your sleep, whereas the patient will have light, shallow sleep as compared to deep, restorative sleep.
For these reasons, patients taking opioids need to be aware of some very important safety precautions which they must adhere to. Number 1. Never drive or operate heavy machinery under the influence of an opioid. Number 2. Never think that it's okay to take more than your prescribed dosage at the prescribed times. Number 3. Avoid waiting until the last moment or after work hours to get your prescription refilled. This will just frustrate you and your doctor. Please call 3 business days before your refill will be needed. We'll be happy to help process your prescription refill as efficiently as possible. Remember, once you've left a message, it may take 2 to 3 business days to process your request, so please call in early and be patient while we work on your refill. Number 4. Never think that it's okay to take an opioid whenever you feel pain and run out of your dosage early. It's not okay, and your prescription won't be refilled any earlier. Number 5. Never drink alcohol or take other drugs that may induce fatigue unless directed to do so by your doctor with his or her supervision. Also, remember that marijuana and any other illegal drug in Idaho may amplify the unwanted effects of opioids in your body. That's why taking these drugs is not permitted under our mutual pain treatment agreement. Number 6. Never take opioids to treat other conditions like depression or anxiety. We know that people who suffer from one of these conditions may be twice as likely to want to misuse opioids. Don't give in to the temptation. Number 7. Always store medications where others cannot access them, and be particularly aware that children or teenagers have been known to experiment with prescriptions, sometimes with dire consequences, because they feel they're safe. So keep your medications locked up.
Time and again, people tend to skirt the precautions or try to think there are exceptions to the rules and die. I've had teenagers and young adults who have either stolen or misused the drugs or given to somebody else who has misused the drugs with tragic outcomes. Over 20% of Ada County's accidental deaths are caused by accidental drug overdoses.
In fact, accidental opioid overdose is now the second leading cause of unintentional deaths in the United States, fueling the prescription drug abuse epidemic. Consequently, opioids are tightly regulated in Idaho. If you've misused opioids, Idaho Physical Medicine and Rehabilitation will stop treating you, and other doctors' offices may refuse to treat your pain too. Remember, there's no magical cure for chronic pain, and pain medications will typically help with only about 50 to 60% of pain. They're designed to block pain, not treat the causes of pain. Opioids are not intended to eliminate all pain, but are intended to improve ability to perform functions such as exercising, walking, and working. If the opioids do not help you function better, then they may be stopped. Also, if you're not giving exercise, non-opiate medications, and other approaches a chance to help you feel better, it may be a sign you're placing too much emphasis on opioids and neglecting the very things that may help you improve.
Remember to let your doctor know if you're having any side effects. By adhering to these safety precautions, you can be confident that you're using these medications safely to achieve your treatment goals. If you have any questions about opioid drugs, please let your doctor know. We're happy to help. We hope that you can live a great life. Even though you may have pain, your life can be happy and productive.